Hello everyone, Dr. Mandell here with you. I want to say hello and hopefully you're having a great day or night. Today I want to talk about the masseter muscle. What is the masseter muscle? It's that big, thick, strong muscle in our jaw that's interrelated to many symptoms. Headaches, TMJ, facial pain, neck pain, forward head posture. This takes a lot of the jut of stresses that we put upon it day after day, physically as well as mentally. So I'm going to show you a great technique, very simple, right up into the camera. I'm going to get real close. We're going to follow along with the pictures. You're going to love this if you're having any kind of discomfort in the jaw, the headaches, maybe in the frontal, the temporal, even the occipital. This is something that may do you a lot of good. Let's go and explain a little bit about some basic anatomy. If you look at this, you can see that where the arrow is pointing, this is the masseter. This is the strongest muscle in the body per size of any muscle. It is based on the jaw working, primarily clenching the teeth. What's amazing about this is that we get 55 pounds of pressure of that jaw closing on the insides. There's up to 200 pounds of pressure on those molars. That is pretty powerful. This masseter muscle is the facial muscle that is chewing all your solid foods. If we look over here, just a little bit more of the anatomy there, how you can see how it all comes together with the other muscles, particularly the mandible area, the lower jawbone or the cheekbone. This masseter muscle is divided into distinct sections, primarily the superficial, which is the top layer, and the deep portions. The superficial portion is that thick and tendon-like portion of the muscle that connects to the cheekbone, while the deep portion is that smaller, more muscular portion of that muscle that connects to the mandible or the jawbone. So let's get right to it. Real simple. I think you'll enjoy this. Here it can show you, this shows you the TMJ joint. People get clicking, popping, headaches, discomfort, pain that radiates. This is a very painful situation. By releasing these particular muscles can do wonders for you, really can. If you look up here, that's a temporalis muscle. You can see how the size of that, but we're going to focus primarily on these masseter muscles. First thing I want you to do, I want you to clench your teeth together. Put your fingers on the side of your face back over here, right over where that muscle is, that masseter muscle on the bottom jaw here on both sides. Clench your teeth, clench it again. You'll feel the muscles contract. Feel those muscles contract, they kind of like pop out when you bite down. Okay, what we'll do first, we're going to take either these two fingers or these three fingers, whatever you like. I just like to take these three fingers, put it on top of the facial area, right where my fingers are. We're not going to go to the jaw yet, start up here. And I want you to push in, and I want you to open your mouth. As you open your mouth, I want you to push in and push your fingers downwards. Go ahead. Good. Come a little lower. Do the same thing again. Push in and downwards. Again. Again. So what you're going to do, as you push in those muscles, okay, you can see they run parallel, but as you push in those muscles, and as you push down and in, and as you open your mouth like this, you'll feel it stretch. You're going to get those deeper muscles. That's actually going to stretch because you can be building up adhesions, fibrotic tissue. The muscles can they're just not pliable and moving because maybe you're clenching your teeth and they're just contracted. So you're going to actually go through the different points on your face. It can take you a minute, 2 minutes, and just start pushing it in and down as you open your mouth. And you'll really start to feel it stretch. Now what I want you to do, very simple, take your thumb. Start from behind here, where I'm at right here on both sides. And all I want you to do, you can leave your mouth closed. I just want you to take your thumbs and just go forward on your face, right along that muscle. And go lower. Okay, keep going. Now you could actually go back and forth, but it's actually easier just to go from the back to the front. Work your way down the jaw. You can see where that muscle is. Okay, I don't want you coming up here. Know where that muscle is, back over here, because when you clenched your teeth, you should feel where that muscle is contracting. So we're just going to start up here, go across, come as we work our way down, just like this. Okay, now you'll feel all that whole jaw, you'll start to feel it release. It's fascinating. This can take away your pain immediately, but remember, muscles have memory. So that means that if the muscles have been sitting a certain way for so long, they're going to want to go back. Start doing this every day. You can do it in the morning, in the evening. You'll figure out the best position of your fingers and the best technique that works best for you, but concentrate on the anatomy of where those muscles are at, and you'll really feel a tremendous difference. I really hope that this will help you, and I really think it will. Make sure you do this. I really think that it will make a big change in your health. Many people out there, even though you have pain back in here or your neck in here, it's all interrelated. Remember, forward head posture brings your head forward, puts a tremendous burden upon the jaw because the occipitalis muscles, occipital region has to come upwards like this, and there's excessive contraction along the muscles of the jaw affecting the TMJ. And that TMJ, by the way, can affect tinnitus, ringing in the ears, vertigo, dizziness, loss of equilibrium, giddiness, you name it, it can affect all those symptoms. So I'm really hoping that whatever symptom you have, this makes a positive change for you. I ask you to check me out, Facebook, Motivational Doc. Leave your comments below. I really appreciate you tuning into this video, and please subscribe if you haven't so you can continue to get notifications. God bless you and your family, and we'll be back with you real soon. Bye-bye now.